Hi, the Greater Bowie Chamber of Commerce is pleased to bring you the Bowie Business Journal, where we showcase its members and their services. Today our guest is Darrell Carrington. He's the founder, managing director of Carrington Associates. Welcome, Darrell. I'm glad you came out today. We have a lot to talk about. I understand that you are a lobbyist for the medical marijuana or medical, what do you call it, medical cannabis?
Medical cannabis. And
Okay.
first of all, thank you for having me on today. We're very pleased to be on the show. And yes, we're happy to be here to talk about the medical cannabis program here in the state of Maryland, and hopefully to have a discussion in which we can talk about some of the myths and fears that people have around the program, and maybe be able to alleviate some of their concerns.
Truly, we only care about what goes on in Bowie. So, I mean, I know there's a lot happening across the state, and that's good, but I want to dispel the myths and the fears for people who live in Bowie, because I believe now we do have a dispensary, or one that is coming shortly. And what I want to do is let people know that they're not going to be a bunch of drug addicts hanging around.
Absolutely, Diane. And that's a very important point for your audience to understand, especially for the residents here in Bowie, and I am a resident here in the city of Bowie. The dispensaries in the state of Maryland are more secure than your bank. People have a better chance of breaking into your bank and getting money than they do of breaking into a dispensary and walking away with money or any product. You may be able to steal some paraphernalia or break a glass shelf or something, but you will not get product or money. Our facility, safety and security, was the first thing that went into the legislation that created this program. And what people have to understand is that we've been looking at the medical cannabis program in Maryland for over 40 years now.
Oh, really?
Yes. Originally, and you may actually know this name, the first person to put a bill in for medical cannabis in the state of Maryland was a delegate by the name of Wade Koch. Yes, and he is now currently on the Baltimore County Council. And Wade Koch was the first delegate, and he was a Republican, who put in the medical cannabis bill. 20 years after he did that, another Baltimore County Republican, Don Murphy, put in the medical cannabis bill, and it didn't go anywhere. So about, I guess now we're looking at 2012, 2013, a real big push was put on to get a compassionate use program here. And what really tipped the scales was the stories from the parents here in Maryland whose kids were dying of epilepsy after their parents watching them endure 8, 9, 10 seizures a day.
Yeah.
And it didn't matter if you're a Republican or a Democrat, everyone has someone in their family that either has epilepsy or cancer, chronic pain, wasting away. I mean, there are so many conditions that cannabis can help to alleviate. So it was remarkable, because Annapolis is not a place in which everyone always agrees on everything.
Right.
But for this particular, what people would think would be controversial subject, only 11 legislators out of 188 voted against this bill. So it was as bipartisan support as we will ever have on anything. So
there was enough evidence to the contrary to show that this is an important new old drug.
Well, and I think the experiences of at that time, it was about 23 other states that had the program in place, and there wasn't a lot of diversion, so I mean, products going from one state across state lines. All the things that people feared, all the opposite came to pass. There wasn't any diversion. We weren't having young people hooked. As a matter of fact, people under 18, their rates of usage went down. Because just like with alcohol, if you regulate something, you make it much more difficult for underage folks to have access. And because, an alcohol license is so lucrative, people really work hard to protect it, so they're not going to do anything stupid like sell to a 12-year-old and risk their license when they can sell to you and I and know that, it's safe for them. So we have found that same process in the medical cannabis space all across the country. And that has been helpful in helping other states to be able to move forward and implement their programs.
And I assume that they're electronic prescriptions and not paper prescriptions.
Oh, well, and we have to call them recommendations. Prescriptions is a different category. The reason why physicians are allowed to make recommendations is because they have a First Amendment right to say to their patients what they think would be the best course of treatment, regardless of federal law. So that's how physicians are safe to be able to tell a patient, I believe that making a recommendation for you for medical cannabis is a much better medical alternative for you than this opioid that you've been taking that you're going to get addicted to, and the like. So
Or your kids can take what you have in your medicine cabinet.
So, that is something that I think that hopefully will give residents here in Bowie some comfort, is that this was really well thought out over several years before it was implemented. The regulations are, the regulations for this program, that are in COMAR that require what you have to have in place for security. So, for example, in a dispensary.
Excuse me, before we go, what is COMAR?
COMAR is it's the Code of Maryland Annotated Regulations.
Okay.
And so that governs, so we have all these different subjects. So the medical cannabis program is section 1062. And that's the health, that's under the health code. So every department of state is in COMAR and prescribed there as to how you do everything, how we do our food stamp program, how when you go to the MVA, how that's going to occur. So every process in the state of Maryland is dictated by some type of a COMAR reference. And so these statutes that we have in place that make up the framework for this program are resolute and rock solid. And they've been tested, and as in the last 3 years that the program has been in existence, we haven't had any diversion, we haven't had any break-ins. So when I said before, these places are safer than your bank. They literally are, and they're written in the law that way.
Before we go back to where you were, does like Medicare or any drug policy, insurance policies, do they cover that? Because it's not regulated.
Unfortunately, at this particular time, because it's still considered a Schedule I drug at the federal level.
What's Schedule I?
Schedule I puts it in the same category as heroin, cocaine. I know it's shocking and ridiculous, and it also stops us from being able to do research. The only country that's really doing good research around cannabis is Israel.
Yeah.
Israel is probably the leader in research for cannabis, and Dr. Meshulam was the first scientist back in 1967, I believe, to separate THC as the psychoactive compound in cannabis. So it really isn't a long history of us having any science. 50 years is nothing when you're talking about understanding the science behind it. I mean, some of the things that we do know is that you have 216 cannabinoid receptors in your body, which means that which is why cannabis can help people who have cancer. I mean, actually, there are peer-reviewed journals
help so many
that
different
are saying
things.
Exactly, because you have so many of these different receptors in your body, it really does become a miracle drug.
Wow. Well, I do remember seeing an ad, and it did come from Israel, where they were showing a man who had such bad Parkinson's, he couldn't hardly stand and walk, and he was shaken so bad, and they gave him the medical cannabis, and he took it, and in 20 minutes, he was calm, and he got up, and he walked around, and he was like that for several hours. And so, it's not like somebody's going to take it more than they should. I mean, if you stop walking, you take it again. If you start shaking. And I was just so in shock. I said, why are we, the United States, keeping something like this from being legal and helping people? I mean, you see someone with Parkinson's and it's horrible. My minister, when he married my daughters, his hands shook so much, I thought the Bible was going to fly off. And there was no help for him except for an experimental brain surgery where they would drill a hole in his head and poke a part of his brain and I thought, you don't want to do that, but he didn't want to shake. And yet we have this product that seems to be a miracle. I mean.
And its attitudes need to change. I mean, quite frankly, when it's something new, sometimes people are afraid. And when you've labeled something as dangerous and as a drug and it's illegal, people start to believe that even though it's not true. And so, I mean, our reefer madness from the 20s,
yes,
this was all done on purpose. I mean, it's not conspiracy theories or anything, but the true history of cannabis in our country, you go back to the 20s and DuPont developed something called nylon. And at the time, we used hemp for rope,
Right.
for sweaters. I think the Constitution is written on hemp paper. George Washington was a hemp farmer. So hemp was a major, major, major textile, a major agricultural product in our country. But it was going to be competing with nylon. So you tie hemp to marijuana and tie it to the Mexicans and the jazz culture. So it's blacks and Mexicans.
Yes.
And so it was very easy to say, this is bad, those dirty Mexicans, those dirty blacks in the jazz culture, we have to,
Wow.
make this illegal. And that's what we do in our country when we can't make a people illegal, so we make whatever the people do illegal. It's the same thing, the Chinese smoked opium. Opium was never illegal in this country before the Chinese came in, but that was one way that you can harass the Chinese, was they did opium. The history books are there. You can, people can your audience can Google it. I'm not making this up.
No, I know it.
This is actually real.
I smile because I have read of some of that, and I'm always in shock. Yeah,
it is shocking.
It is what we do. Yes, it is.
So I am hopeful now, and with the work that we've done, I was very fortunate to be one of the founders and the first executive director for the Maryland Cannabis Industry Association.
Okay.
It was a group of professionals, entrepreneurs and the like that were interested in this particular space, and we recognize, just like any other industry, if you don't get united and have a group representing you, then you get ignored. And I think MDCIA was very instrumental in helping set up the regulations. We did some of the early trainings. We worked in partnership, hand in hand with the Medical Cannabis Commission when it was set up. And we were very fortunate to have that partnership with them, where we could, we can do joint trainings together, or we can combine resources and talents. And so I thought that was very helpful in the program.
So
Maryland
part of the laws that were written, they are different levels of licensing?
Yes, that's a great question. We have 3 different license types in the state of Maryland. I guess I should say 4, but we have growing, which is the cultivation. We have processing, which is the manufacturing, taking the raw flower and either packaging it nice and pretty, or making a tincture, an oil, a thermidor patch. We can now do edibles, so you can make butters and oils that can go into edible products. And then we have the dispensaries, or the retail side. In the state of Maryland, well, we've changed the laws a little bit, but initially you could only own one of each type. So you could own one grow, one process, and one dispensary in an integrated model. We changed the law this past year so that you can have up to 4 dispensaries under the grower and processor. So it's letting them consolidate the market a little bit more. I don't think that that's helpful for diversity. I think that some of the smaller groups are going to get swallowed up, and some of those smaller groups are going to be women and minority-owned companies, and I don't think that that's healthy for diversity. But I believe the state was kind of stuck in a position where it had to do something to allow some of the industry forces that had already forged these management agreements to be able to continue forward. So it got very complicated, and I think they tried to get a very good resolution to it could have become a very uncomfortable situation and avoid additional litigation, because this program has endured enough litigation over its first 4 years.
Certainly has.
But I can guarantee you we have much more to come over the next few years. So it's certainly the Attorney General's office and private attorneys around the state of Maryland and across the country will have a lot of billable hours out of our program over the years.
So we all know growing and cultivating, so they would be marijuana farms or cannabis farms.
Everyone in Maryland is doing indoor.
Oh, really?
You want to, especially when you're talking about medicine, because you want to control the amount of contaminants and
I see.
And so indoor grows. Also, it's the legal term is an attractive nuisance. If you have a field of cannabis growing, it's going to attract a little
like
bit of attention.
The end rows of the corn.
So we probably want to be. And literally most of the warehouses, they're very nondescript. You wouldn't know that they're growing medical cannabis in that facility, and that's the way you really want.
So they have to employ some people.
Oh, that's one of the things that was troubling when I saw some of the zoning, and even here in my home county of Prince George's, is that anytime any other industry comes in and says we're going to create hundreds of jobs and generate millions of dollars in revenue and blah, 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 your arms are wide open, you're embracing them, you're having parades for them. And as the medical cannabis program came in doing these same things, when you look at it in the aggregate, they weren't always welcome. As a matter of fact, it was quite hostile in certain places. I had many clients that I would have to tell them, okay, you're not going here, you're not going here, you're not going here. Because I said to my clients, I want you to get in where you fit in. Go where it's a welcoming community, because you are going to be a very beneficial part of that community. And I can't speak for the Bowie dispensary, but I do know for the firms that I've represented and that have worked with me, we make sure that we work directly with the community before we even, before we do anything. We go in and we talk to community leaders, we talk to civic groups, we talk to interfaith groups, because we want people to know who we are, what we're doing, and how can we best help serve the community that we plan on being a part of for the next 30, 40 years. So,
with everything that you said, it seems that this is going to open the door for a lot of jobs. The cultivating of the product, the making it into something else and then selling it. That's 3 separate areas for jobs.
And not only that, we were speaking about earlier, but we also have independent testing labs. One of the things that was unique about Maryland's program in its inception was we were the first state to require an independent testing lab to test batches of medical cannabis, because this is medicine. So we're already talking about people who have compromised immune systems. The last thing I want to do is give them cannabis that has mold or heavy metals and the like. So that's the other thing that's wonderful about the Maryland program, is that people know that they're getting a reliable and safe product. And each one of the products, and we'll talk about jobs, but each one of the products from seed to sale, so from the time that it's a plant to the time it's actually sold to a patient or a caregiver, that particular cannabis can be tracked all the way back to where it grew in a pot. So it can go. It can go from one cultivator to a different processor to a different dispensary. The cultivator could be on the Eastern Shore, the processor could be in Western Maryland, and the dispensary could be here in Bowie. And I have a chain of command, a custody that I can follow for that. So everything has an RFID tag on them.
RFID?
RFID. I'm sorry, tag on them. And
what is RFID?
Radio frequency identification.
Oh.
So it's high tech, and there's all these protocols and processes that you have to go through as the cannabis goes from the grower to a processor, and then there's requirements for the trucks, and then there's requirements from the processor to the dispensary. And there's also, of course, requirements from the grower or the processor to the independent testing lab. So you're looking at all of these different, so you got growers, processors.
I didn't think of the trucks to get it to the processing.
And you have to have somebody who's delivering. You have security. I mean, security is huge.
Yeah,
and we're
like
talking,
a Brinks truck.
Yeah, like a Brinks truck. And there's also all kinds of requirements upon what the trucks have to be, certain size, markings on them, what uniforms the drivers have to wear, et cetera, et cetera. So everything is, I mean, down to the minutia. I mean, we do not give you any wiggle room.
But we're not taking it across state lines.
You cannot take it across state lines. So you think about all those jobs in the independent testing labs as well, but then, all the folks that have soil companies here in the state of Maryland or other places, we have to get soil, we have to get lights, we have to have tables, we need beakers, we need lots and lots of plastic and jars and shelving and all of these wonderful things. So the ancillary benefits and all the ancillary businesses that we were talking about, lawyers, accountants, lobbyists, there are a ton of professionals that work with this industry. And I mean, and we have social events and the like, so we rent out halls, and just like every other industry here in the state of Maryland, we contribute to the economy and the bottom line. And yes, we're creating new jobs that are green jobs, and these are literally the jobs of the future. These are jobs that are coming to our state if we so choose, unlike a factory job in which you're going to be building a widget. Those jobs are gone away with the dodo bird. Right. So we need to be a lot smarter, and the NIMBY ideas that we have sometime, and I witness it around here in Bowie, yes. And it's sad to watch. And don't get into, I mean, you have to think about your kids and your grandkids. You want them to have this great community that we've lived in, but they can't have buggy whips. They need to have new stuff. Right. So we have to continue to build and develop. And I hate losing trees. I'm an environmentalist. I love trees, but we're going to have to sometimes lose a tree and a squirrel in the name of our child having an opportunity to play professional hockey one day because they play in the highest right. hockey rink here, or they get a scholarship to play golf because they got to play at the Bowie Golf Course because it was an affordable place for their family to take them to play. We have to keep amenities here in our area, and this is one of the ways in which we go about paying for is bringing in new industries that we never had before.
Absolutely.
We didn't have medical cannabis 5 years ago, let alone 20 years ago. So I hope that the business community and residents can start to really get away from their fears about this. The only people who will be going to the medical dispensaries, the retail entities, the one that we have here in Bowie, are people who are patients and caregivers. That's it. You can't consume on premises. You can't consume in the parking lots. We have security in all of those places, so it's not like a meth clinic where there are the dregs of society hanging outside looking like death, and no knock on people who are struggling with addiction and trying to get over it, but I'm just saying the imagery that people have of what this may be, and it is far from that. What our dispensaries are, for the large part, are high-class, high-scale doctor's offices that you go into that have medical cannabis behind shelves and the like, and it's as professional and orderly and clean and professional as you'll ever get. So I hope that if people have some things that they're suffering from, that they talk to their doctor. If their doctor won't certify, we have a list of certifying physicians, one near you, on the website for the Maryland Commission, and that's the easiest website in the world. It's mmcc.maryland.gov, and that's where patients can find out how they register for getting a medical cannabis card, the provisions of the program. Caregivers, if you have a loved one they can't care for themselves and you want to get them medical cannabis, you can go on there and you can register. Everyone can register there. They'll give you all the information that you need on how to get your card. They're working about 2 weeks or so, 2 to 3 weeks to process from the time you submit your application, as long as it's complete, to when you get your card. And then once you get your card, you actually go to a certifying physician, and they will be able to make the recommendation, and after that you can go to one of our dispensaries, one of the 75 or so.
First.
You have to first you have to register with the commission first and be approved. Now you can start looking for a doctor while that's pending, but you do have to have your registration with the commission first. Then secondly, you get your written certification from your physician. That's why it's not a prescription, it's a written certification.
Would that be like your GP, or does it have to be a pain doctor?
No, any doctors in the state of Maryland that are in good standing with their DEA certificate can apply for no charge to be a certifying physician. Okay. Now, the benefit for physicians obviously is helping patients that are suffering, but selfishly, there are certain requirements on how many times a patient has to visit their doctor to continue their certifications. So for some doctors, they're going to see a patient 2, 3, 4 times, or a patient they would have never had before, just based upon having this medical cannabis program. So it's very smart for them to register, because this is opening up an entire new group of people to your practice.
Well, and it's also not just treating pain, so that's why you would not have to necessarily be just a pain doctor.
Yeah, exactly. I mean, for all the various, oncologists, but also in the state of Maryland, 2 years ago or 3 years ago now, we added dentists, podiatrists, midwives, and nurse practitioners to folks who can make the certifications for patients. So you don't just have to go to an MD. You can go to any of the other medical professionals that I just spoke of.
Wow.
So basically, if you have prescribing authority in the state of Maryland, then we thought it appropriate for you to be able to have that same type of certifying ability in this program, which opened up the amount of service providers for our patients. And by the way, in the state of Maryland, we have had more patients sign up than anyone imagined. We didn't think that we would hit. We thought maybe the first year we would hit around 80,000 patients. We're well over 100,000 in the first year. And so we think we'll be over, if the numbers carry out, we should be well over 200,000 patients in the program by the end of 2020.
There are a lot of people living in pain and living with various forms of infirmities that we don't know about, and they've had to live with it and suffer in silence. And now we truly have something that'll help them. And I hate to see old attitudes and old ideas prevail. So this is one of the things we want to do, is to stop it. We do have one dispensary in Bowie?
We have one dispensary in Bowie. Yeah. There are some challenges in locating dispensaries in Prince George's County. There are a number of zoning rules, and I understand why they put them in place. However, this industry shouldn't be treated differently than any other legal industry. So, for example, you can find far more dangerous drugs in Safeway, Shoppers, Walmart, Target. None of these retailers are required to do 1/10 of the things that they're asking this industry to do, to sell something that's far less dangerous to our society than the drugs we're allowing these retailers to carry every day.
Wow. Well, you know what? We're out of time, and I haven't even asked you anything. So I'm going to do something that I don't usually do, and we're going to have a part 2.
Excellent.
So I would ask everyone to please tune in next week for part 2. It's very, very important information, and I hope you all learned a little something from this week, and we'll see you next week. And